Hello, everybody. Welcome to our Natural Health News Live show. Sorry for my delay. We had some YouTube and then children delays here. So welcome to our daily news show where we talk about COVID surge news. I give you updates here in the U.S. as well as updates around the world for our very large international communities. Also, we are going to talk specifically today about a really big journal article that came out about the connection of COVID and obesity, even mild obesity. So I want to dig into that because that is a metabolic syndrome. That's a big part of my practice and clinically with what I do with my patients. So I want to welcome all of you. YouTube seems to be, I don't know what's going on with YouTube, but seems to be buffering potentially. But welcome to all of you joining. This is a daily live show, and I definitely want to encourage you to comment in the comment box below. I might have to bring YouTube back on for whatever reason. It doesn't seem to be going live. So let me quickly. Yeah, YouTube, weird. I can't see you on YouTube. Okay, so I'm going to Instagram. Thanks for your patience. I'm going to end YouTube and start it over again. It kept giving me all sorts of error messages. So let me do this really fast. I don't know what is going on with this. Okay, so let me do this. Sometimes YouTube, I don't know if this might have something to do with the Twitter issue. You know, Twitter got hacked, and I'm sure YouTube's freaking out about that. So let me just do this. COVID and obesity. Links to okay. See how fast I can get this up and running. All right, so let's see here. All right, so for all of you on Instagram, while I'm grabbing YouTube back up here, comment and let me know where you guys are located. And let's see, let me do a quick smile. I just smiled for my thumbnail. Okay, so let's go live. Let me see if I can bring them back on. Yeah, there was a Twitter hack. Good. Welcome. Let's see. Hi, YouTube. Welcome. I'm hoping you guys can see me and hear me okay. This is our second trial at bringing you back on live. For some reason, the live doesn't look like anybody's joining, so that we might be having a little bit of a challenge. Usually I have about 30 or 40 that instantly pop on. So let's see. Yeah, it looks like it's buffering a bit. Let me change my Wi-Fi settings and see if that changes. Okay, so YouTube, hopefully you guys can see me. I don't have anybody on here. Oh, here we go. Let's see. It's unstable. Okay, YouTube, if you can hear me, give me a thumbs up. Comment in the comment box below. Gosh, this might be a bad morning. Okay, well, all right, sorry, Instagram. Yes, it's not showing up. That's so weird. Thanks, pal. Hey, everybody, we got Brooklyn, Kentucky, Michigan. Hi, Christine. Let's see. Yes, there was a YouTube or a Twitter hack. Apparently hacked into like celebrities and some politicians like Obama, Joe Biden, Kanye West, Kim Kardashian, Elon Musk, and it was some sort of Bitcoin scheme. But the fact that they broke in is kind of scary. And then because of that, they locked down all the verified participant or verified Twitter accounts, and that actually, they're the National Weather Service, they're verified. They got locked down, and apparently they had alerts to give out to a community because there were tornado warnings, and so they couldn't get out the tornado warnings because of it. I mean, that's really crazy. Okay, so YouTube's being wonky. Let me end this stream. End in studio. Okay, and I had it live. Okay, so hold on one second. Let me just go to. We've even boosted our Wi-Fi. Like everybody's working from home, and I have business Wi-Fi. I don't know why it's doing this. Okay, so I might abandon ship here. YouTube, we get 3,000 people who join us on the live every morning, so I just want to make sure I don't let them down. COVID surge. I'll just change all my title stuff up later. Okay. See if I can get them on board. Make sure I'm not doing anything wrong. Audio device. Okay. I'll quickly smile again. Sorry. The woes of going live. Okay, so let's see if we can bring them back on. Hey, Jana. Okay, so YouTube, welcome everybody. I'm hoping that this doesn't buffer. This will be our third and final attempt. And it doesn't look like anybody's joining us. It's doing all sorts of weird buffering and delays. So what I'll do is I'll just take this recording and pop it over on YouTube when I'm done and call it a day. So, okay. All right, well, Instagram, so welcome all of you. I'm so sorry for the delays, just technical issues, but I really want to dig into, first of all, my printer is needing new ink, so I need more paper, more ink. But really the situation or specific topic today, I wanted to talk about obesity and the links to severity of COVID. And there's some really great research coming out of the European Journal of Epidemiology that we'll talk about. So, yeah, Jana, I don't know what's going on. So yeah, Instagram's going to be the way to do it. I just save it to my phone. So I'll post a little, it won't be the best imaging, but whatever. So let's just dig into some news. So the world's at 13.5 million cases. The US is at 3.5 million cases. We've had more fatalities yesterday. So we are at 138,358 fatalities. Globally speaking, we're having a little bit of a challenge, even in some of the smaller communities hit by COVID, of identifying how the spread has occurred. So there are a ton of origins unknown in terms of how people have been compromised or have been infected with COVID, which is a challenge when we're talking about contact tracing and identifying major sources. The big news yesterday is there's new modeling out of the University of Washington that highlights the forecasting by November 1st. They're anticipating 224,000 fatalities. So Lost Daisy, YouTube's a no-go today. I tried 3 times and it won't post. So I'm just doing Instagram. So the status with this virus here in the US is that it is at and beyond community spread, meaning that there are a lot of sources and origins unknown. We also have a really lacking testing capacity and as well as testing supplies. So testing is having the same crisis we had back in March. We're also starting to see and witness some PPE challenges, and even the states that aren't hit the hardest, but they're still dealing with COVID cases. So there's just problems kind of all across the board that we're going to talk about today. I do want to highlight internationally, Brazil will be hitting 2 million cases probably tonight or tomorrow. They're at 1.966 million. India is also going to probably hit 1 million by the weekend. They're at 974,000. And then Russia's at 752,000 cases. Tokyo has had cases. I talked a little bit about the base in Okinawa. There are now 136 positive cases on base. So there's an Army base and a Marine base, and they're almost equally divided between the two. And those individuals are actually going out into the Okinawan community. And so there's big spread, but I'm going to say potential of spread. But the Japanese officials are very frustrated by the Americans not communicating. They had this issue, and they were all running around on July 4th, celebrating and visiting the local restaurants. So they're attributing that to the major spread. But Tokyo, the city itself, is on, they rose their alert level to the highest level. And are encouraging, they haven't had any lockdowns yet, but they're encouraging people to take the social distancing and all the safety measures, mask wearing. That's really easy. I lived over there for a year. You just wear masks, like it's part of it. Seasonal allergies, cold and flu, it is not uncommon to wear masks. And I will say when I was there, it was just after undergrad. And as an American who doesn't do that, it was eye-opening. I was like, wow, where are those people wearing masks? And I remember my immediate go-to was an association that person might be sick. And that's actually, it was a stigma that I had to get over, and that's just part of the culture. And that is something I think we're also dealing with here with the anti-maskers. But just globally speaking, there's great increases happening. But the U.S. continues to increase, and we are seeing just all different types of changes in terms of political, not political, but I'm going to say ordinances starting to occur. So, for instance, Alabama, the state now has a mask mandate. We saw yesterday, or I think it was the day before, the Oklahoma governor, he's identified that he is a positive case. We are seeing also some rollback. So here in Georgia, our governor last night signed an executive order and basically wiped out the local authorities of the mayors of Atlanta and Savannah who had employed stay-at-home orders as well as mask-wearing orders. And he's banned those local mask ordinances in his executive order. So Atlanta and the Georgians are pretty darn frustrated. We are seeing some major increases here as well. Let's talk about California. This is kind of interesting, very telling. We're starting to see some activity from certain states and locking down events for a period of months. So Pennsylvania, Philadelphia is starting to lock down events, which means like the Eagles games might not be seeing participants in the stands. We're also seeing the Rose Parade is canceled. That's in January in California. So there's starting to be some anticipation in terms of that this is longer term, and they're starting to make certain measures or put measures in place due to the fact that this isn't going anywhere. And we're going to see substantial impact on our lives for the long term. I've been saying for a while that we're in it for the long haul. So Florida, you guys know I live there. One of our viewers today, Christine's down in Florida as well. We work together. I love that. So Florida passed 300,000 yesterday, so they have 301,000 cases. Their overall, from the beginning to now, their average positive percent rate is 13.55%. That's almost 3 times where they should be. And the higher you get, some days are averaging 20-30%. Some of that's based on batching from the labs. There are significant lab delays. And I'm highlighting that as I can because that might also be skewing some of the numbers. The data being what it is, it doesn't change the fact that there are positive individuals potentially not quarantining and potentially spreading the virus, but it just means that these delays are impacting our ability to get control over the virus. Yesterday, Florida had the second highest death rate. There were 133 Floridians who died yesterday. It's the 10th consecutive, in 10 days, they have posted over 100,000 positive cases. And despite what the communication is, there's a lot of politicizing of this communication, but the reality is they haven't really seen an increase in the amount of tests being run. There's a higher demand. We don't have enough of the equipment. Facilities or these testing sites are running low. They have to turn people away. People are getting in line at 12 midnight, 2 a.m. to get signed up. So that's definitely problematic. I do want to say that the southern Florida, Miami-Dade is getting really rocked. There are multiple hospitals, I think 10 in total, that have over 100% ICU capacity. Now, Texas is a state I want to highlight. One of the things that you think we would have learned from New York and obviously Washington, that was the first epicenter in the nursing home world. But the nursing homes, there are significant infections happening in nursing homes. They have posted over 1,000 new infections. We have seen a total of almost 1,200 fatalities in Texas nursing homes. In July alone, 224 of our seniors in these nursing facilities have passed away. And part of the challenge here is that there's inadequate PPE. So the nursing home individuals are having challenges with getting the right gear. And they're also seeing with one of the things that they're attributing to the increase in the cases is that over Memorial Day, they started to open up again. And when that reopening occurred, what happened is two things. You have the workers starting to be more mobile, and some of these workers are working at multiple locations. So there's potential spread there. The other thing that is happening is that the individuals in the nursing homes could start to go out for outpatient care, dialysis. They could start to go see their doctors again, maybe get their haircuts or whatever. But most of it is medical in its orientation of their outbound activity. And that is potentially a spreading source is what they've identified. I will say San Antonio is getting rocked. They had, I think it was 3 weeks ago, they had like 500% increase in positive cases. And then they started to see the hospitalizations increase. And the mayor was really screaming for assistance there. They now have contracted refrigerated trucks. Yesterday, they alone in San Antonio, they had 20 deaths from COVID. So these refrigerated trucks are going to be outdoor morgues or adding to the morgue capacity in the hospital setting. That is very, very concerning. And these are not numbers. They are names, they're faces, they're lives. They are connected to communities, families, and there are American citizens. And we are losing individuals at a very rapid pace. Philadelphia, I do want to highlight for any of you living in Philadelphia that Philly decided their school is going to go 2 days in class and 3 days online. So there's going to be an alternate schedule. I don't know the logistics of how that works, if it's going to be staggered, if it's going to be staggered by grade or whatnot. That just still remains to be seen. We actually have some friends that live up there. So, they were definitely seeing some impact with the planning of schools. I know the county that we had Gabriel in, Polk County, it's a county north of Tampa, they pushed back their school start date by 2 weeks. I don't know what that hopes to achieve. It might be a stall tactic for the community to additionally continue to stall or at least work out some sort of way to take things online. But we're also seeing some additional, some other states that necessarily weren't in the hotspot arena starting to come online. So Virginia is going to be a state we're going to watch out for. Their cases are up by 43% and hospitalizations are up by 23%. And Rhode Island is one of the states in the Northeast that they have PPE challenges. They're running out of gowns and out of masks and, the hairnets and all of the equipment that they need. In Virginia, particularly, there might be an epicenter coming to light in the jails. There's one facility in Virginia that has 46 inmates that have tested positive. We saw in California, San Quentin is just a massive, explosive positivity rate. They are not even getting soap and sanitizer. There's no social distancing. And now those inmates are going outbound, that then spreads. So Virginia hopefully won't be in the same state, but we're, not same state, but in the same situation. There are a few, there's 6 states where they've seen this week alone increases in fatalities. Louisiana, Kentucky, Michigan, Nevada, New Mexico, South Carolina, Tennessee, and Utah. Those are 6 states that have seen an increase in the fatality rate. And there's a lot of data today. I'm very bummed that my printer went offline so that I literally have burnt my printer out. I've run through a ton of ink, more ink than I have in several years in this time frame. But I do want to highlight today we're going to talk about COVID and obesity. That's going to be our main topic. There's a European Journal article of highlighting the different degrees of BMIs and links to severity, but there's also a lot of other research. So one of the things that is, and I've been witnessing this as I'm digging through the Survivor Corpse post. Now I'm getting alerts on all of them. That's the Facebook page I was talking about yesterday and last week, that it's now over 70,000 survivors, people dealing with COVID. They're getting positive tests. It's a really good clearinghouse and community-based support group, but also they're learning information. And as a content creator for our daily shows, I'm reading that just to pick up on things that you might not be hearing. They're sharing a lot of really great data. I love that. One of the things that is come to light, I've been seeing lots of posts in this group, but also just in some research, we don't know 100% if you're fully immune. So we know that there's right now no herd immunity. We know that antibodies are only about 50% accurate. So there's certain types of antibodies. You have to develop this one type that then protects you from the virus. Not everybody's presenting with that particular type of antibody, and it drops off after a period of time. 2 to 3 months is a time frame. Well, then the big question is, can I get reinfected again? And if you are in a forward-facing customer service role, if you are a nurse, if you are a care provider within your family, is the possibility of reinfection possible? And likely. And right now we don't know the answer to that, but the answer right now is it's highly likely. Some of this is specifically related to the research that we know. So right now research is showing 60% of our population get the right potent antibody. And of that, 17% of those individuals, they see that potency remain after 3 months. And yesterday I reported the news, let's see if I have it over here. Yesterday, I moved it. Yesterday I reported that what we're seeing is that possible previous coronaviruses might give us additional antibodies. But at this point, it's possible that you might be susceptible to reinfection. 13% of asymptomatic carriers lost their immunity as well. So for the asymptomatic carriers, the first time they first go around, they might not have any symptoms. They take a test maybe because they have to go back to work, or somebody, they got a contact tracing call or whatnot. And now they've got exposure again. And sometimes that second round is worse. So there is a possibility to be susceptible even after having had COVID for the first time. The other thing that has come out, the CDC did research and dug into that Missouri situation. Back in May, I reported there were 2 hairstylists. So when the reopening started to occur, in May, 2 hairstylists had tested positive. They had been working. They saw both of them over a period of a few days, saw a total of 138 clients in their very socially distant health, the state and CDC mandated guidelines, they were adhering to that. So there was social distancing. Everybody was wearing masks. 98% of the clients had their mask on 100% of the time. The 2 hairstylists never took off their masks. And what they found is that still to this day, nobody who is in that place of business has tested positive for COVID. And they show no antibodies either, which means that there's been something that's worked in that situation. And so the CDC evaluates what has worked. What has worked is the social distancing. They had, kind of staggering of the chairs. They had hand wipes. They sanitized after every client. They didn't max out their schedules. And the other thing that they really identify is that the masks did lower the transmission rate. It was part of the critical aspect here that was employed to limit the spread, and it worked. And so that is a highly positive example of the benefits of masking. They also, the CDC, I think we might be hearing a little bit more roar from the CDC, given that they've been cut off in terms of the reporting of hospitals. The federal government wanting the hospitals to really kind of reroute their reporting of cases to HHS and ultimately some National Guard entity. But I think we're going to hear a little bit more roar from the CDC. And in fact, yesterday they posted a lot of data on their website. One of the things that they posted was an urge or it was a research. Because I didn't print it out, I can't remember the name of it, but it's on there. You can look at the news. They have the MMWR. So they have an early release of the morbidity and mortality weekly report, which is huge. Usually they come out late tonight, early tomorrow morning. So they've already posted that, and they have posted a call to wear masks and the benefits of mask wearing. So I know that there's stuff happening behind the scenes. And I know, there's a mistrust, but here's the deal. There are scientists and researchers that is all they do. If you're going to be mistrustful of the politics at the higher end. Don't distrust the data, and don't write off the scientists and the researchers, because they're the ones. I mean, it's not just the coronavirus, friends. It's herpes. If you've had shingles, your data and information has come from the CDC. We have all been benefited by the CDC and the efforts that they've had. So it is kind of irksome that a lot of people distrust them. And there's an actual campaign happening right now to discredit them for I don't know why the purpose, but the discrediting of science, data, and research, it has to stop. And so I just, I'm going to call timeout. I call BS on the conspiracy theories and just the nonsense that is happening. They have valuable data, and we need to look at it, and we need to analyze what's coming out of that and help us make decisions to be healthier and safer. And so I understand the distrust, but it doesn't negate all the positives that come out of that. And I will continue to cite and highlight information. I mean, the contact tracing that they posted that I highlighted yesterday and the day before, we learn valuable information. And without that, how would we be equipped to understand how things spread? You would not be equipped with the information that an elevator is one of the riskiest rides and riskiest places for you to be. Same with the information that public bathrooms are unsafe, because we know data that they've researched and posted. So it's really critical that we just table the politics and look at the pure empirical data. Okay, that's my little soapbox. It kind of is irksome. But I do want to highlight, before we get into the Obesity Journal article, more data is coming out about our blood typing. So I've highlighted, every time it's come out, I've highlighted it to you guys. It's usually been the main kind of topic of my video chat, but today it's just, there's a lot of great information. I was very excited digging through all this. Out of the Annals of Hematology, they look at Massachusetts cases. So Massachusetts, Boston had huge outbreak in March, April, and May, and they pull over almost 1,300 individuals. And it's a blood type study. And what they look at is that the blood typing, ultimately, it works out. They look at all these individuals or hospitalizations, and then they say, okay, well, what blood type are they? And so out of the almost 1,300, it's 1,289. So I'm rounding up 1,300. So out of 1,300 people, type A was 34.2% of the population hospitalized and in a severe category. B's were 15.6%, AB was 4.7%, and O was 45.5%. And what they identify is based on the severity and, the study, it breaks out, age, median age. They look at the different underlying health conditions. They look at also ventilation, oxygen. And what they've identified is the blood type that has the lowest risk of testing positive is O. And that is, now we have 3 core studies. There was a Chinese study, there was a European study, and I highlighted that, I want to say 5 weeks ago. And then there's this study. So now we've got it in China, in Europe, and in the US, where there were, it's kind of follow like that spread. Categorically, O's, we're not exempt. I'm in the O blood type. We are not exempt from catching this. But the way our blood, somehow, the proteins or the lack of certain proteins in the O blood type seems to keep the degree of severity at bay. There are O's who have severe cases. So, O's are not void of risk, but we're on the lower risk. Now the difference here, and I don't know if this is based on, Boston and that area. And if you are from that area, you understand this. I lived there for a few years. People generally don't move away. Like if they're from Boston, they live there forever. Like their whole friends, they're integrated. I mean, they've got generations. They can link back to who in their family got off the boat from, Ireland. I mean, I just remember a lot of my friends that were from Massachusetts literally had been there forever. And their families had immigrated. So one of the things that is really, really interesting is that the change in this study, as opposed to the other two studies, is that A, blood type, it shows no risk. Like there's a risk, but it's in the middle. Where the other two studies showed definitively A's tended to have the greater severity. Now this also, if you have been familiar with the blood type, you rate for a blood type, if you watch that live show, you can go back and watch it. It's all on YouTube. And by the way, I saw somebody, I will be posting notes. It's going to take me a while. Today I've got Gabriel. I do mommy time after these, so it's going to take me a few hours probably to get this posted on YouTube. And Instagram, for whatever reason, didn't even post. I think I saved it, but something happened and I lost it. So my hope is to post it. I might have to go back and add details later. But what is interesting is that the blood type that is more at risk in at least what we see in this 1,300 individuals in the study, B and AB are at the highest, are at the greater odds of testing positive or having it be severe. So I thought that was really interesting. And I don't know if that has to do with some of the makeup of the fact that people, who are from there and live there, their families and their ancestry, like their strong bloodlines, like genetic bloodlines. I don't know. So that is kind of interesting. I found that very, very interesting. But I thought also at the core of this, O blood types tend to be on the less risky scale. So just FYI on that. Now let's dig into COVID and obesity. So the European Journal of Endocrinology, and they dig into obesity, and they specifically look at the BMI. And so categorically, they look at, okay, everybody in this sample size in Europe, how many of these individuals that have had severity, how many of them have a BMI of over 30? And it's a fifth of the patients who have severe, they're on ventilation. Actually, a quarter of the individuals with a elevated mild, moderate to severe obesity, a quarter needed ventilation. They also identify the 30 to 34.9. That range, that BMI, at that 30 mark is where we start to link respiratory failure and the obesity component. Now, some of that might be, and I work with folks that they'll sometimes come to me and they have sleep apnea. And, one of the first and most impactful ways of dealing with sleep apnea is to get rid of excess weight. So, weight up here in the upper torso, lower abdomen, the diaphragm, we take off the pressure. And so that can also minimize the impact of breathing. But there's also core links. They found that with the high BMI, there were links where there was type 2 diabetes, cardiovascular disease, and what they've identified is with that BMI, the respiratory failure is where we see also that's that threshold where COVID takes root in the lungs, and then you see the kidney and the heart involvement. I found that really fascinating that somebody's really dug into obesity and its links to COVID severity. It's one of these things we see on, the underlying health condition, but we haven't really had anybody dig in significantly into this. And, I work with lymphatic patients that, like, I got a message from one of my patients yesterday. She doesn't even live here. She came into town. She lives in the Midwest, came to see me for several treatments, and then purchased one of my machines that I work with that motivates the lymphatics. And I train people to use it on their own, and did that with her. And in her working with this machine and doing all my exercises and activities, she's dropped 50 pounds. 50 pounds is significant. So, when you're looking at obesity, it's not just always fat. It can sometimes be fluid retention. It could be inflammation. And so there's obesity that gets linked up with folks that have underlying metabolic imbalances. And these metabolic imbalances, that's what I really want to talk about. So there is something called metabolic syndrome, where we see individuals that have an imbalance of their metabolic process. We see a great degree of blood sugar imbalances. So that's where obesity starts to be linked to diabetes. The metabolic syndrome will also link folks to heart disease. It increases your risk of stroke, arterial sclerosis. So we actually see significant impact due to the underlying condition of obesity, but there's layers that add and contribute to that. So blood sugar is one of them. And my favorite, a very easy way to manage blood sugar, along with diet and exercise. But what we find is diabetics tend to be lacking in core minerals. And there are two core minerals that will help offset insulin resistance and glucose intolerance. They're chromium and selenium. You can get those by, taking, I don't think I have it here on my desk. You can grab those by taking trace minerals, multi-minerals. You can also eat Brazil nuts to get your selenium dose. Those too also will help your thyroid balance. So there's a connection to metabolically, the thyroid gets whacked out. And I've talked a lot about the underlying aspect with thyroid disease. It's often stress and its orientation. It's also autoimmunity. A lot of that is diet related. So Hashimoto's can be resolved with dietary changes very easily. But then also underlying systemically within the whole body is an inflammatory state. And when we're talking about COVID and the multi-system inflammatory triggering, it's basically a multi-system inflammatory disease. We've labeled it as such for kids. We haven't really come out fully and said that with adults. But this inflammation, we see cellular inflammation, we see organ glandular inflammation, we see soft tissue inflammation. For any of my lymphatic patients, especially my lipedema patients, they have all sorts of inflammatory conditions. And that leads to excess fluid buildup and water retention. It's not uncommon for me to be working with an individual that just has milder cases of lymphedema, and they're holding 20 pounds in an arm or 30, 40 pounds in a leg or in the abdomen. You can really hold a lot. I mean, any of you who may have had a cyst or any type of tumor or known people, like you'll hear of women who have grapefruit-sized cysts on an ovary and they had no idea. Well, you can hold a lot of space in your abdomen and not totally be tuned in before you start to see the expansion. In the category where obesity is involved, there's sometimes an even harder capacity to see what all is going on, where maybe a thinner framed individual might see a protruding mass or protrusion where you start to see fluid build up in one space. So at the end of the day, with this particular disease, obesity is one of the categories where there's multiple systems already compromised and imbalanced. And what it takes is addressing metabolic syndrome, addressing the whole entire body, the endocrine system, the hormone balance, the inflammatory state. One of the things that I love for inflammation is the InflameX. And this is something that we sell in our full script store. I'll link up there for you guys when this gets all wrapped and I can figure out how to post it up on YouTube. From my phone, it could literally take about an hour and a half with the link of these shows. But I will say that cellular inflammation, the systemic inflammation, is at a root. It's in the root layers, root cause of obesity. And one of the things with obesity is it just doesn't happen overnight. There's usually a sequence or a series of events that occur. For a lot of women, it's hormonal changes. Sometimes what triggers it might be the premenstrual time, so early teen years. There are also imbalances in the thyroid, and then we'll also see changes in terms of how the metabolism functions. And we know that early on in childhood, if the child is obese in childhood, the likelihood of them being obese as adults is high. So it starts kind of early on. And there's also a gut connection. So digestively, having a healthy gut, having good healthy bowel movements is going to be critical. And it also can be part of that reversal. So there's multiple systems that I want to encourage folks, if you or anybody you know is dealing with a higher than average BMI, or a BMI that's putting you on the cusp of mild, moderate, or high obesity, severe obesity, then you actually are going to need to do a lot of work at balancing multiple systems within your body. And while exercising and eating are a huge aspect to creating that balance, it's often just that alone, diet and exercise. For some people, it can resolve obesity, can get them back into healthier BMIs. But that alone doesn't always have the capacity to change that metabolic syndrome. So folks will still, even if they've lost, 20, 30, 50, 70 pounds, and included in that are the gastric bypass surgeries, which, by the way, this journal article was written by a gastric bypass surgeon. So I find that interesting as well. That is a very positive solution, but it's a stopgap measure. It doesn't resolve the underlying imbalances. And a lot of times when folks undergo these surgeries, they don't resolve those underlying imbalances. And in fact, it sometimes triggers more. Even though they're losing weight, they don't necessarily have the stomach capacity to get all the nutrients, the density. It causes adrenal stress. Just even the metabolic change of burning more weight can trigger some imbalances in the neurotransmitters. So it becomes critical that we address all of those different elements. And I will say that there are ways to naturally lose weight in a healthy way that also nourishes the body. I am definitely all for nourishing, supporting our, getting all your macronutrients, making sure you're increasing your enzymes, your rich probiotics, spirulinas and your rhodiola and your moringa powders. Those are all going to be helpful in supplying your body with nutrients, minerals, and antioxidants. Cytomegalovirus 2 says, also lost 50 pounds and just steady for a couple years now. Body is working so much better than obese with so many meds thrown at my symptoms. Yeah, and a lot of times the symptoms, the medication is just like the surgery. It's often a stopgap measure. And, the surgery too, I see a lot of complications with surgeries. I see even bowel twisting that occurs sometimes just depending on the surgery and the degree of scarring that occurs. And cytomegalovirus says, yes, I'm always shocked how many supplements you mentioned that I already take. That's good. Yeah, moringa is fantastic. With obesity, we have to address the thyroid. We need to address stress levels. We need to address the inflammation systemically. We need to address insulin resistance and glucose intolerance. And most importantly, one of the things that gets completely missed in traditional medicine, where functional medicine, we're going to look deeper, is we need to address the hypothalamus, the pituitary, and the adrenal axis. So we call it HPA axis. And there's a lot of really powerful ways to do that. I've highlighted a little bit. I use glandulars for that. I do much more extensive testing than probably is traditional with a lot of providers, because we want to dig into the specifics of what all is imbalanced and address that from a perspective of creating overall health and wellness within the body. And how we do that is we measure inflammatory markers, C-reactive protein, your A1C levels. We'll also evaluate some of the neurotransmitter imbalances. A lot of times GABA, a decrease in norepinephrine, epinephrine, serotonin, or dopamine imbalances can also trigger cravings and a feeling of not being satiated or full. So we can address some of those underlying chemical, endocrine chemical imbalances, we can dig further into the balance that we want to see. And so I thought this was really critical. I think this is going to be really also impactful. I would love to see the U.S., and I'm sure that's happening. I'm curious to see what happens with the U.S. and the assessment of COVID and obesity. I also want to see further information about people of color and obesity. That might also be one of the reasons why Georgia was seeing higher cases of severe COVID cases within the people of color. I know the state alone, we have higher obesity levels within the people of color in our area. Let's see, Lori, have you seen any links with people with thyroid issues? Is this a predisposition for virus? Hashimoto's is considered an autoimmunity, not necessarily immune compromise, but there are heart links. So it kind of depends on the degree of thyroid, but I haven't seen anything specific to the thyroid in the study itself. I also haven't seen any reporting of the impact of the virus on the thyroid. I know that the thyroid has susceptibility to other viruses. I don't think it's going to be as great with the ACE2, but I could very well be wrong. I mean, this is one of these things we are learning every day. And today was a big research day. I wish I could have printed out these research articles for you, because there was a lot of really good information for folks on this specifically. So, and I'm so sorry about how YouTube just didn't connect today. I really don't know what's happened. But I have a feeling, I just feel like YouTube's going to go into some measures. They're probably going to try and be more secure. If Twitter can get hacked, YouTube definitely could get hacked. So, so I'm hoping we'll resolve. I'll probably get some sort of message from the folks that Okay, so yeah, Lori, I'm very curious. And hey, Whitney. So, yeah, it's very interesting, especially today. There's just a lot of information. I don't know. I'm trying to dig in, going back to the CDC, trying to dig in how that rerouting of hospital data is going to impact our assessment of positive percent rates. I just don't know, but I have a feeling that there's going to be more that we get from them. I'm hoping. I still have faith. I mean, I try and hold out faith for folks, but I really do. I still have faith in, the number 2 doctor. I think she's fantastic, is well known, has a really great reputation. She's also the one that, early on posted where the CDC was going wrong. And I think we need to listen to people like that when they're calling out their own. There's transparency there. And so I'm hoping we'll see more of that as maybe they've gotten pushed out of the kind of alignment. Maybe they can start to get themselves back into a better status with us, who are trying to rely on as much valid data as we can get. Okay, so I don't know her name, Lori, but she posted, I highlighted it, I think it was in April, she did an assessment. Basically, it was like, the CDC totally screwed up. We missed the ball. We literally dropped the ball, missed the boat. She highlighted the fact that, the original tests were contaminated. I will say, I didn't mention this extensively, but the one thing I've tried to research, I'm trying to kind of figure out, there's nothing out there right now that lists the labs that have the worst accuracy levels in any one clearinghouse, but I am curious because there's a lot of communication, particularly from some of you on YouTube. You comment, you message me, but also from folks on their Survivor Corps page, that Facebook page of 70,000 plus COVID sufferers and survivors. They are saying that they have taken tests and they've come back negative, but they are still symptomatic, and then they take another one maybe in a different format and it comes back positive. It is very interesting. It's very interesting that might also be skewing our numbers. And that is something that number 2 doctor, I want to say Dr. Lori something, but it is very interesting because I know that's going to factor in also to people's sense of being okay. Like, okay, I'm totally fine. And, I will say I took our dog out last night for a walk, and I went maskless. I was just like, I was mindless. I, didn't have to do bedtime, and so I took her out for a walk. And I was just really alarmed. There were a lot of people in our neighborhood walking around, nobody masked. And I literally took routes that I didn't see people. And when we passed by where people have walked, I literally held my breath and closed my eyes. And I mean, that's just terrible. So, I think we are also seeing this whole, unknown origins. That is definitely that airborne aspect. It doesn't help that people are not answering COVID contact tracers calls, but it's very telling that this is spreading a lot faster than we can contain, and that's what the U.S. is dealing with. It's really just bizarre. I first go through the U.S., then I hit the world. I have all these different things that I pull every day. And, like when I'm writing down, we had 13,000 plus cases, or there were 9,000 plus in the state. And then you hear of like Japan, in Tokyo, they have 300 cases and they're freaking out. Or like in Melbourne, 3,000 and they're on a 6-week lockdown. They've closed their borders. It's just perspective. And, wherever you are in that, I think we have to collectively come together to work this out. And school is going to be the big tell of how successful we are with that. Male husband, hard at work up in Houston. Not happy he might have to quarantine on return. Oh gosh, okay. Other countries are doing better than the U.S. I was reading an article that highlighted like South Korea. They're doing great. And they have, deployed a whole bunch of measures to keep their community safe, and they're somewhat as back to normal as we all hope we would be. But we're not there yet. And the modeling the forecasting is not great. It doesn't look like that's going to be changing. And so, we just have to kind of see what happens. But I wanted to give you guys this information today because I think it'll be helpful for any of you who are dealing with, a BMI over 30. There's, the categorization of that BMI, but definitely there are links that this virus does hit these communities and populations that have these, the higher BMI value. And so, now if you're trying to be preventative, this is a good time to really focus on addressing that. And there are a lot of tourists. South Carolina is linking a lot of their explosion to tourists on the beach. And that's also what we're going to see too, is people are going into the mountains. I have a lot of friends that I know here in Georgia. They're all up in Highlands and Cashiers, North Carolina. Well, North Carolina is dealing with an outbreak, actually less than Georgia. So anyway, I, again, apologize for YouTube for whatever reason it didn't go online. Very bummed, but definitely I will post this on YouTube at some point, and tomorrow I'll announce the mask, the shield winners, because I haven't seen the 3 ladies on here. So thanks everybody for tuning in. I will see you guys tomorrow. Hopefully we'll be okay. Tomorrow is our live Q&A Friday. We'll post on the stories questions so you can ask or call for questions. But thank you for joining me today. I appreciate your patience, and I will see you guys tomorrow. Bye everybody. Have a great day.